أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الكريم وعلى آله وصحبه ومن استنى بسنة يوم الدين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي السلام عليكم ورحمة الله وبركاته. Welcome to this webinar, this free webinar sponsored by Balagh Academy. I think some of you know it, and if you don't know, you can go to the website, albalaghacademy.com, and you on Google, and check Google, and you find all the information about Balagh. Today's lecture, it's Jinn and madness, the myth, the malady, or misdiagnosis. And I mean, this title, somebody wrote to me the other day and said to me, did you publish something? And I said, no, but it gave me an idea maybe to do some writing on it. It'd be a very interesting topic, although I've covered some of these in other of my articles or books. Anyway, let's move on. So what we're going to do is to explore the intersection of cultural and religious belief about Jinn, the supernatural being, with modern medical understanding of mental health, from a psychiatric perspective. Now, this exploration will provide, I hope, some valuable insight for mental health professionals or clinical psychologists, Muslim psychologists, Islamic psychotherapists, and many others who work in diverse cultural settings. We will focus, of course, on how different cultures, particularly Islamic ones, and how this affect diagnosis and treatment. So our goal is to offer, an overview, a very brief overview of both the sort of the intersection between Jinn and more or less mental health issues. Okay. Now, and to start with, anyway, it's nice to see quite a lot of people. I think this is a very interesting subject, and which permeate in all health and social care professionals encounter these sorts of problems in their clinical practice. Now, my question first is, when we talk about Jinn and madness and myth and malady and misdiagnosis, I want to challenge you with a question here. Is it possession or is it psychosis? But the important question is, who decides? Me? You? From what perspective? Do you look at it from a Western Judeo-Christian perspective, or do you look at it from an Islamic perspective? Now, this question, hopefully, would encourage you, the audience and myself too, to think critically about authority and the power dynamics involved in identifying first and also diagnosing mental health condition. For example, do mental health professionals have the final say, or are cultural and religious belief equally important in defining what is happening to the person, to the client? This is the central questions that hopefully we will return, inshallah, throughout the lecture, and it helps highlight the potential for misdiagnosis when cultural and religious contexts are, in fact, totally ignored. We have 4 main objectives, the 3 there, but anyway, where we dwell in the concept of Jinn, from Islamic theology and culture, understanding their roles in both spiritual and social contexts. That's one, anyway. But the second, we will examine the historical, and cross-cultural definition of madness, particularly in Islamic study, very, very brief. Third, we will discuss the risk of misdiagnosis when cultural belief, or rather religious belief, are not taken into account in mental health setting. Inshallah, we'll explore how this knowledge can inform ethical practices in cross-cultural mental health, or what we call transcultural psychiatry, emphasizing the importance of both culture or have cultural sensitivity, and also integrated approach to therapy, to mental health care. Let's move on to the next slide. Origin of belief. Now, whether you believe in jinn or not, if you're Muslim, you have to, because it's in the Quran. The surah that you read every day, most common surah, the three kul days, and the hadith and so forth. So, I mean, if you're Muslim, then you believe in it. If you're not Muslim, then that's another issue. So the belief in jinn dates back to pre-Islamic Arabia. It's not something just, but in Islamic theology, they're created from what we see from scorching fire, as mentioned in the Quran. And jinn are, for example, you can see, we're going to look at it next anyway. Jinn basically are concept being with, they have free will, like us as human. In fact, they live a parallel world to us. They do everything that we do. They have free will. They are believers. Well, some of them are like human, some of them are not. And they procreate, they have family, they do everything. There are big difference between it. You think about it, what the difference between jinn and man anyway, but that's another question. Think about it. And so they're considered to have free will, much like human. Some are good, like I said, some are, and others are shaitan or evil. And they're often seen as intermediaries between the spiritual world, the cosmos, and also, the human. But in many Islamic societies, as we know, that jinn are believed to play a direct role in human affairs. Daily thing, to do with health, to do with mental health, to do with spiritual health. So understanding the Quranic portrayal of and the pre-Islamic origin of the jinn belief is essential to understanding how they continue to shape, cultural and religious perception of illness today, or the attribution of mental health issues or problems. As you can see, this is the next slide about the thing there. Of course, there's many other. I need to switch that thing off. This is one of them from the Quran anyway, and the jinn we create before from scorching fire. Okay, let's move on. Now, when you look at the role of jinn, in many traditional societies, jinn are believed to have a profound influence on health. They are often, or assumed, to cause mental health symptoms such as, for example, sudden mood swing, irritability, aggression, hallucinations, which might be interpreted as possession, what I call, the possession syndrome. In Islamic culture, I should say in Muslim culture, there's different between Islamic culture and Muslim culture, some psychiatric symptoms, such as, for example, we call dissociation, when you're separated from your body, you're alien to your body. They are often linked to some sort of spiritual experience involving shaitan or jinn. So the jinn is not limited to the supernatural, but also impact on our daily behavior, on the social behavior, our health practice, on our spiritual practice, and also how individuals understand illness, leading to different responses to mental health challenges, including spiritual intervention or spiritual healing practices. Despite the availability of modern medical treatment, more or less psychiatric treatment, or psychosocial treatments, many people in Muslim majority region or Muslim living in the West, so the same, all what we call Muslim diaspora communities, still turn to the lay healers, to the spiritual healers, or imams in certain cases, or religious leaders for help with mental health issues. Not only mental health, it could be divorce, it could be some other things, but a lot of them do use what they call in sociology the lay referral system. So in fact, you know, I was amazed when I was doing a course last year in Burnley in England, and you know, come across people who are very experienced Iraqi who does you know, ruqya, or those who involved with different spiritual intervention. But I forgot the name of it now. But these people said to me, even through those, they're not imams, of course, there's some of them are, but you know, through these sort of different practices, yeah, they are counting people that's coming to them with their psychological problems. Anyway, we know from research in America, you know, that people, you know, do tend to come to the first point of contact, again, using that lay referral system to more or less, you know, what we call imams or religious agents. Yeah. But we go back to, so a lot of them, you know, go to those leaders or imam, or sometimes some of them are already fake people, but some of them are really true, sticking to the Sharia, or the do not. Anyway, that's another issue. But this is not necessarily because of a reflection of ignorance, yeah, but rather it's embedded, yeah, in their culture, yeah. That's what I call Muslim culture, and also the worldview, where the spiritual and the psychological realms, you know, are intertwined, are interconnected. Now, these beliefs are deeply rooted in cultural practices, and in some cases, you know, also in religious teaching, which may provide a sense of times comfort and understanding. So psychologists, therapists, mental health professionals must be very sensitive to this perspective in order to build trust, empathy, compassion, and also facilitate effective treatment. Let's go back to look at the historical view of madness. Madness or mental illness is a concept that varies significantly across cultures. In Western medical setting, madness is typically classified using, for example, the DSM-5. For those who don't know what DSM-5 is, DSM is Diagnostic Statistical Manual of the American Psychiatric Association, which was more or less came into practice in 2013. They call it, before that, there was DSM-4 and so on. So DSM-5, you know, is the madness is typically classified using focusing on symptoms and behaviors. However, in many cultures, I just need to switch that off because we're in different time zones, so it's different time. Just give me 1 second, sorry. Okay. Okay. Hope you can see it and you can hear me as well. Right. So we're talking about how in the Western medical setting, or the pathology, psychopathology, we tend to use DSM-5. We're focusing on symptom behaviors. but we're talking about how in different cultures, including Islamic societies, mental disorders are not simply seen through a medical or biological lens. Instead, they may be attributed to spiritual causes. Sorry. Yes, of course. I'll stop my video. They may be attributed to spiritual causes, or sometimes moral failing, or supernatural influences. Now, understanding these cultural differences is key to providing care that is both sensitive, that is also respectful and effective, rather than reducing everything to a psychiatric diagnosis. In non-Western culture, experience of madness, I'm talking in Western culture, I'm talking about different, even non-Muslim societies as well. You know, in non-Western cultures, experience of madness often reflect culturally recognized framework of spirit possession. For example, in East Africa, in Tanzania or Zanzibar, you have the concept of the 𝐁𝐚𝐥𝐚𝐿. 𝐁𝐚 same as jinn possession. And of course, in many countries, you have different terminology. If you look at the sort of what they call the cultural syndromes, from DSM-5, there's a lot of those what we call the cultural syndromes. We won't go into that, but let's focus on the culture. So different cultures sometimes have different names, a different concept, for different type of possessions. Now, this experience can follow significant life events like trauma or grief, and are understood through a spiritual or moral lens. Now, the experience of madness is not always seen as pathological, but as a spiritual crisis, or it could be a test of faith. In these cultures, the interpretation of what is happening is shaped by the community or society understanding of the world, which help provide a context for ill health, for suffering, for distress, or trial, or tribulations. Let's consider a case study. Let's consider a case of could be anybody, okay, Somali woman in the United Kingdom who begins to hear voices. Her family believe that she's possessed by a jinn, while the medical team from the local psychiatric services diagnose her with schizophrenia, a form of psychosis, or severe psychosis. Now, initially, this lady refused or resist all form of medication, but is willing or was willing to participate in spiritual intervention or Islamic spiritual intervention, or what we call sometimes ruqya or Quranic healing. So when both medical and spiritual treatment are combined, her symptoms improve. Now, the other case where the symptoms is not improved, because in fact, the medication, psychotropic substances, major tranquilizers, I suppose, would be given to this lady, that sometimes exacerbate or increase her deterioration. And other case where the client or the patient has been taken to see some of those fake Raki, fake imam, because they use what we call not Ruqya Sharia, which means Ruqya based on the Sharia, but they use Ruqya Sharia. They use shirk, they use jinn to treat jinn. Anyway, so you could see on both sides, yeah, sometimes they may have a mental health problem, but they get treated by, a spiritual healer, or they may have a spiritual problem and get treated from the stuff medical, pharmacological, biological point of view. Now, in her case, when both Ruqya and some cases of antipsychotic medication, her symptoms improve. Now, this case highlights the importance of sometimes integrating cultural practices within conventional treatment, which allow for a more holistic and respectful approach to care. It's a powerful example how cultural sensitivity can lead to better health outcome. Now, this next slide compare the symptoms. What was? No, it doesn't matter. These slides compare the symptoms of jinn possession with those of psychosis, especially schizophrenia. Now, many of the symptoms overlap. For example, auditory hallucination, sudden mood changes. However, there are critical differences. For example, those experience possession often describes their symptoms within a framework of spiritual meaning, which contrasts with psychosis, where the person or the patient may have little insight into their condition. So cultural context is crucial in distinguishing between the two, as mislabeling possession as psychosis or vice versa can lead to inappropriate treatments. Sometimes it's very difficult to tell which is which. Now, how do you know which is which? I'll let you think about it. What tests can you do to know that this person is nothing to do with jinn possession? In fact, there are evidence to suggest that most patients, whether they come from Durban, they come from Birmingham, they come from Dhaka, they come from Jakarta, they come from, Bangalore, or they come from, Paris or New York, most Muslims tend to state that they suffer from jinn possessions rather than they have a psychiatric problem. But majority of patients that come to different sort of services, do have a psychiatric problem rather than, having a sort of possession syndrome. The possession syndrome would include evil eye, black magic, which is sheer, and also jinn possession. Now, doesn't mean we're denying it, because as Muslims we believe in it, because it's in the Quran and Sunnah. It's very rare. Even in my practice, I've come to 2 or 3 people maybe have both. Yeah. They are both jinn and, but like I say, the majority do not have, jinn possession. They have psychotic problem. But at the same time, we cannot dismiss about the supernatural causes of the ghayb, of the supernatural world, which again is evidence in the Quran and Sunnah. So what about the diagnostic challenges? Well, I mean, if I'm correct, DSM-4 did recognize possession, some possession, but not jinn possession. So diagnosis of mental illness or mental health disorders or psychiatric disorders can be particularly challenging when cultural and religious belief are intertwined with symptoms. There is a cultural. I'm just giving an example. I'm not saying that you have to use that. There are other tools as well, that can be used of what we call the cultural formulation interview, which offers clinician a structured way to explore a patient cultural understanding of the illness. I put that there. Why? Because a lot of us work in statutory bodies. We have protocol to follow, we have procedure to follow, and so forth. If you're working in private practice, that's a different matter. So that's why I make it like a formalized thing. So by asking questions, that probe how patients view the symptoms and what cultural or religious explanation they hold, clinician can gain a more complete perspective or understanding of the patient experience. Now, this approach helps ensure that treatment respects the patient worldview, in that case, Islamic worldview, while providing appropriate care. Let's imagine there's no video, but I'm just going to get one. But anyway, let's imagine a scenario, right? And not this one, but a patient undergoing ruqya, spiritual healing. That's why it's called ruqya, which when you read verses of the Quran, other than people there are specific verses. That's another issue, but verses of the Quran. And and that person, while the Quranic verse links to Baqarah and so forth, and suddenly the patient reacts violently to the Quranic recitation. Now, if you look at this client or patient from a biomedical model, even biopsychosocial model, you might interpret this as suggestibility or some sort of neurological condition. Sometimes maybe even physical condition that cause that, or like epilepsy. However, the healer views this as proof of possession by jinn. Now, these contrasting interpretations show the importance of understanding the context of the person's belief. As healthcare providers, it's essential to respect these differences while ensuring that the patient or client receive care that address their sometimes underlying complex needs. Misdiagnosis occurs all the time when cultural context is disregarded. If a mental health professional, a therapist, psychologists, label spiritual experience as mere psychosis, they may overlook the spiritual significance of those experiencing for the patient. On the other hand, interpreting psychotic symptoms as possession can delay the provision of appropriate psychiatric care and interventions. Now, this highlights the need for clinicians to consider the sort of religious cultural factors when making a diagnosis. Ensuring that both spiritual beliefs and mental health conditions are properly understood and treated. There are many consequences of misdiagnosis. It can be severe, leading to harmful practices, such as sometimes people get forced exorcism or unnecessary hospitalization. In some cases, individuals may reject psychiatric treatment, believing that their condition can only be managed or cured through spiritual intervention like ruqya. This can also result in both social stigma and isolation. So by adopting a more cultural sensitive approach, therapists, mental health professionals, psychologists can reduce the risk of this negative outcome, offering a path towards healing that respect the individual belief and their spiritual, physical, social, psychological dimensions or needs. Here is an example of recovery. A woman suffering from catatonia, which is severe, catatonic, schizophrenia, psychosis, was initially treated as if possessed by jinn. Her condition did not improve until a local imam was involved in her care. With the imam's spiritual support combined with in medical pharmacological treatment, psychosocial treatment, her symptoms begin to resolve. This case highlights the importance of a comprehensive, culturally informed treatment approach, because the involvement of spiritual care can complement psychosocial interventions, leading to better outcome and helping the patient or client to feel heard and also to feel respected. In terms of interventions, you have biomedical treatments, such as medication. Or you can, I suppose you have psychological treatment, like, psychotherapy, which they're focused on the biological or physiological or psychological aspect of mental health. Now, spiritual approach, like Quranic recitations, prayer. I put amulets there because people use it, but this is haram. Anyway, we can talk about it afterwards. Anyway, people use amulets, talisman, tabiz, or whatever they call it, in different language. Now, we talk about spiritual intervention, but it's not about just Quranic verses. It's about, you can use, stories from the Quran. You could use verses from the Quran. You could use a form of Islamic modified narrative therapy. all sorts of things anyway, Islamic cognitive behavior therapy and many others anyway. But also, you can use ruqya as well. But and also, you can use Islamic psychotherapy. Now, these two approaches, like we have the biomedical, biopsychosocial, and spiritual one, like I said before, that they need not to be mutually exclusive. In fact, clients or patients may benefit from both when integrated into a culturally sensitive plan. But that integration has to be, in other words, halal. What I mean by that, whatever you do from Mr. biomedical, psychosocial intervention, has to be incongruent with Aqidah of Ahlus Sunnah wal Jama'ah, which means that it has to be within, the sort of framework of the creed of, in majority of cases, Sunni Muslim or Shia Muslim. So, but if you say to me, yeah, I'm going to use yoga, I'm going to use New Age therapy, I'm using crystals, and I'm going to include it as part of the therapy. Now there's a problem there, from my opinion anyway. And, so there are a lot of approach, psychosocial intervention, which I've written extensively on this, that are not congruent with the creed, with our creed, with Aqidah. So, of course, these need to be rejected. You only use whatever inverted commas allowed from those evidence-based practices and synthesize it with spiritual intervention. And this is what Islamic psychotherapy is about. Now, in some regions, some models, I know some places before that where, imams sit down in the sort of as part of merchant team, integrative models of care are emerging where psychiatrists work alongside spiritual leaders, imams, to provide holistic treatment. This approach is seen in places like Malaysia, Sudan, where spiritual and biomedical care are combined. These collaborations have led to improved patient outcome and a decrease in stigma surrounding mental health. By involving imam or religious leaders in the therapeutic process, patient or clients feel that the cultural and spiritual needs are being met, fostering greater trust and compliance with treatment. There are ethical considerations or ethical practice involve respecting patient cultural belief while ensuring that treatment do not cause harm. This is part of Qawaid al-Fiqhiyah, one of the maxims. You don't cause harm, or reciprocal hadith, and Nawawi hadith, where you don't cause harm in program. This is part of ethics, anyway, general ethics as well, not only Islamic ethics. No, now for spiritual practice, such as exorcism, or using ruqya shikriya, can be harmful because these people fake, take a lot of money, patient get worse, they use Jinn to treat Jinn. I had clients who had gone through this and the condition became worse because the person who was doing it was using Jinn to treat them, which is totally haram, full stop. So this can be harmful, just as forced psychiatric hospitalization, can be unethical as well. So it's important to approach care, treatment, management of the client, patient with cultural humility, engaging in a dialogue with the client or patient and also their family. As mental health practitioners, I think I mentioned that before, that we can use tools like, the cultural formulation interview to better understand, how a patient interprets the symptoms. By asking, for example, we know that from as therapists to ask open-ended question about cultural and spiritual belief that can help gaining insight into the worldview. In some cases, of course, especially like Muslim, we involve family members or religious leaders in the treatment process, and that can facilitate care. So we need to try to avoid a reductionist approach. People's symptoms, not diagnosis, I'm talking about symptoms, have meaning. And understanding this can guide better therapeutic intervention. Yeah. So we can recap. So today we already have briefly explored some nuance of the intersection of jinn belief and madness, looking at how cultural and spiritual interpretation of mental health illness can lead to misdiagnosis or mistreatment. And a final thought is, sometimes what looks like madness, is a misunderstood cry for spiritual recognition. Now, we have about 10 minutes or so for questions, and I'd love to. I'm going to show you a couple of slides first again, and before we can go to the questions. I'd love to hear from your thought and reflection and what I presented today. Have you, any of you, I'm sure you have, encountered culture-mediated mental health challenge in your own work or experience, or what question or comments do you have regarding how to approach cross-cultural mental health care? Anyway, so now I'm going to just, as we know, we have a very popular course. I'm just going to stop this sharing this. Okay, like I said, we have a course called 𝐁𝐚𝐥𝐚𝐝 and Islamic psychology, and which trying to, it's not going, yeah, there it is, yeah, assessment, and which has been a very successful course, and we've been running it for a few years now anyway. Very, very popular, and we have people from all sorts of background. Let me just and like I said, this is called Mental Health 𝐺IN in Islamic. There are many course objectives. If you want to know more about the course, you can go to the to the platform of Balagh, Academy. We have really course team. We have more than that, just myself and also Dr. Nasib Mustafa Melter. There are also people called Al-Ihsan. There are also people from which is based in UK, and also we have people who Raki, Rukia, and case studies and so forth in this particular course. And I'm not going to go through the learning outcome, but it's 16 basically. These are the sessions, in fact, just that we have a perception of how, because people, Muslim clients, in fact, they somatize their problems anyway. So we're going to look at that, how they attribute illness and evil eye and possession syndrome, evil eye and envy in Islam. Well, the diagnosis, symptoms, and protection, the world of jinn, evidence from the Quran and Sunnah, of course. Dissociative disorder is very interesting in terms of, out-of-body experience and jinn possession. Typology of waswas al-khari, yeah, or scrupulosity, or CD, some form, anyway, as well. I think we look at this as well. Just moving, yeah, and the magic, witchcraft, and demonic possession, categories of education of magic and witchcraft, prevention, therapeutic intervention, spiritual intervention, and so forth. So we look at all these particular topics. Like I say, when you have more time, you can go on the website and look at all the session. It's 16 lectures. 1.5 hour a week, duration roughly about 4 months, probably a bit more because there's sometimes break and sometimes, holidays and festival and so forth. The recording, you can get within 24 hours to 48 hours. Everything is recorded. You always get the PDF, the lecture, and also there are many resources on the platform. And if you do all the little assessment and so forth, you have a certificate as well. And of course, there's a final examination. To get a certificate, there's a final examination, which the administrator will talk to you about it. This is the end of this. Let's have some questions. Anyway, you could use your microphone. Alhamdulillah, there's 128 people. Let me see. I can't read all the chat box, so it's going to be difficult. So I'll try to. But in the meantime, can you please? I'm just going to maybe. Can you use your microphone? First of all, say who you are, which country you're from, and your job, what you do, and your therapist, psychologist, so forth. And you can ask questions. Please leave it to the academic part of it, the administrative part of it. Like I say, you have it all in. You have question and answer, everything on the platform. It's very comprehensive. It's up to date, so you can have all information when the course starts, how much you have to pay, and all this. So I only deal with the content things, and also, questions should be on my talk today. Okay. Anybody? Yes, the recording will be made available, to all those who attended. If you have left your email, I'm sure when you register, you have left your email, so that should be fine. Sorry, I have to come nearer. Maybe you don't see me because I need to put these things very near me because I'm just reading. I'm looking at some question there. How can you deal with misdiagnosis individual? Well, how? Most people are misdiagnosed, and I won't stop my video because like I say, I'm already looking at my nose is touching the screen. Okay, so that I can see. So you have seen me already, so you don't need to see me anymore. Let me see. Yeah, like I say, it is. I mean, sometimes you misdiagnose people, you forget about the spiritual thing, and if you believe in pathology and so forth, and DSM-5, and some people don't use DSM-5, they use ICD-11, which is International Classification of Disease. How do you do? The problem is if you misdiagnose, then you have probably the wrong treatment as well. How can we adapt psychotherapy in those experiencing hallucination? Yeah, that's interesting. Yeah, how I never worked with psychos before in psychotherapy until recently. It's amazing, over the years, so many years. And yeah, the patient who had some sort of delusion and all sorts of things. Anyways, his face was, things that it was growing all the time, and we worked through it. And I treated the person, not the delusion. You see what I mean? But I didn't reinforce the delusion. I think the danger for me, anyway, I'm just me. This is my opinion because I'm private practice, is that if you tend to look at people as label as schizophrenia or depressive and so on, then you're not treating the person. Yeah, you're treating the illness. You're treating this the label. I don't treat label. I treat people. Yeah, so that's the difference. I think you need to look at it that way. Oh God, it's very difficult. One thing notice that there's an aspect of psychiatric medication that can be too strong. Of course, it does. Yeah. For example, yeah. I used to work with some psychiatrists who overdosed my patient, and then I've changed as a psychiatrist anyway. And this could be Hammer. Well, no, not if they're in treatment. Yeah, it could. Yeah, of course they're going to, but if somebody is treating by sedative, that's a valid thing anyway. It's not because they're malingering. So yeah, that doesn't cause a camera anyway. But of course, they can't get up, they can't, because they're so saturated with with medication. Now, if you're taking it as self-medication, that's a different thing. Which means when you abuse the substance, then it's a different thing. They'll have an approach problem of some of the newer medication. Well, like I say, of course, in my younger days when I was in UK in the 1960s, 70s, I used to be so anti-psychiatry, anti-medication. Now, growing old, I do believe that there should be medication, but in very, very limited time frame. Because sometimes you can't work with the client until the symptoms rate. But this had to be reviewed. But many patients, as has been on medication the same for years. They're dependent on them, full stop. I'll post a question on Q&A section. Okay. Nobody's using their microphone, is it? So I just find it difficult to read these things.
Can I ask a question?
Can you say who you are? Can you speak louder as well? I can hear you.
Hello.
Yeah.
Hello.
Yes.
Am
Yeah, I can hear you. Yeah. Assalamu alaikum.
My name is Haya. I'm from India.
Yes.
From Goa.
Yeah.
My question is like, as per your lecture, what exactly you're trying to say is when a person is suffering from anything like psychosis or hallucinations. So what you're trying to say is that this treatment should include both the things like ruqya and as per the what you can say medications and treatment.
Well, yes, it all depends because for example, because I work in private practice, I tend to get all my patients to do ruqya. Now, not because they have a problem, not because they have they have Jinn or whatever. No, it's a purely for prevention. Because how do I know? Of course, most of the time, what happened, I've been working with psychiatrists, been working with a Raki for years, for an imam for years, for 20 years or so. So they refer me patients. So in a way nowadays, most cases, they have already been filtered. So they will go to imam for ruqya and the imam say, okay, no, you don't have problems. Go and see therapist. So in that sense, but I do get patients who come to straight, not through this filtering system, that comes straight to me. Yeah, what I'm saying, no, but not all patients need ruqya. Do you see what I mean? Yeah. Not everybody needs ruqya. Sometimes, purely psychosis, pure psychiatric problems. Like I say, majority of Muslim patients have problems with mental health issues.
Okay.
But we're not denying, because we're Muslim, that they also suffer from nazar, from evil eye, from jinn possession or black magic, because even Prophet Sallallahu Alaihi Wasallam had black magic, poison.
So one more questions like how do you treat the patients who is non-Muslims? Like how we are like for a Muslim patients we can do we can suggest ruqya things and
yeah. Well, if it's a non-Muslim,
suffering from.
Especially working in a multicultural country, you don't apply, you don't apply your Islamic bits to it.
Exactly.
So even with Muslims, this is the danger. Even with Muslims, you have to be careful because don't assume that every Muslim come to you have high iman. Never assume that. Maybe some Muslims tell you, listen, I want therapy. I don't want all this theology, if you're applying Islamic psychotherapy to it, Islamic psychology, or Quranic stories, or verses of Quran, or guided imagery, or visualization, or whatever it is. Anyway. So use a metaphor. So sometimes people don't. So you have to be very careful with your client. You don't assume that. Again, you have to be careful how you formulate your questions. How do you know about somebody's religiosity? So you have to be very careful and be very sensitive to your client. Don't push too much of dawah, inverted commas, on the client. He will never come back. No, build a relationship, have empathy, have compassion, treat the person. And then once you have that relationship, then you can do all sorts of things.
Okay. Jazakallahu khairan.
Assalamualaikum.
Wa alaikum salam.
I'm Sajida from UK studying counselling. So my question is, in terms of, you spoke about having ruqya, but you said that there can be like dodgy rakis and
Yep.
the way they use the Quran. Can you just speak a little on that? How can we differentiate?
Yeah, but the thing, there are many people, even in UK, I live in UK for 35 years, 40 years. And you know, people in every country, you have all these people who take a lot of money and, you know, and ask you to go to the cemetery and do certain thing, and, your mother's name, whatever it is. And they use shikriya, which means they don't base their sort of intervention on the Quran and Sunnah, but they use the jinn. Yeah. They use the jinn to treat problems. So in a way, how do you know? Now, if you know, because people are not registered, you know, of that, it's just difficult sometimes anyway. But you know these people because you know that they charge a lot of money, man, thousands of pounds and things like that. You know.
If they are not doing any of the taweez, the graveyard, and that kind of stuff, and they're only reciting the Quran,
Yeah.
is that okay? Are they
Yeah,
okay
no,
to-
of course. But these people never take money, too much money, you know. They may just need sometimes a donation, you know. And they need to leave, these people as well, you know, this business. And, you know, of course, you know, they are, you know that, you know, when they use the Quran, they stick to Quran and Sunnah, that's fine.
Thank you.
Yeah. Then, you know, it is Sharia. Well, that's what we call it, you know, Ruqya Sharia, which means based on the Quran and Sunnah. Yeah. And the Ruqya Shikriya, which is based on shirk, associate Allah with partners.
Assalamu alaikum. I'm Amna from Pakistan. My question is, as a psychologist, how can I strengthen my own understanding and avoid biases as clinician when addressing spiritual concerns?
Sorry, how do you?
How I can differentiate or understand and avoid my own biases as a clinician when addressing spiritual concerns of my patients or clients?
Yeah, I mean, of course, you know, we go back to self-awareness. Okay. You know, what you're saying that, you know, how you're going to control your biases and so forth anyway. Now, you need to have supervision. That's what we call clinical supervision. It is true clinical supervision where you're presenting your case or whatever it is that your supervisor can look at it and say, right, you know, that's one. Secondly, is self-awareness. Now, as Muslim, as a strong believer, somebody with iman and taqwa, we go through our life. Part of our mission is tazkiyah an-nafs, which means what I call, sometimes I call it detoxification. It is some form of detox, but it's purification of the soul. That's what Allah said that. And there are many cases where, you know, you need to have qalbin salim, which means you have to have a heart, you know, that is cleansed, that is pure. Yeah. You know, and because without this, so as you know, in psychotherapy, Islamic psychotherapy, Islamic theology, you know, the heart is the most important thing, the qalb. Yeah. And it is true that purification of the soul, tazkiyah an-nafs, which we all have to go through. It's not telling you to do something extra. No, do the 5 pillars of Islam. You know, do your namaz, do your nawafil, and your rosa, and your fasting, and your siyam, and you know, and that's all you have to do. Read the Quran, and so, and by this you refine yourself. You move, you know, to sort of you overcome this naf of amar al bisu and nafs of lawama as well, you know, which is found in the Quran. So it's about self-awareness, supervision, and also tazkiyah nafs.
Assalamu alaikum.
Walaikum salam.
I'm Arzu. I'm from Manchester in the UK. My question really is, in terms of, so there's schizophrenia, psychosis, and all these things. Are those then actual sort of like biological issues or chemical imbalances? Because I keep reading things about how the chemical imbalance things like a myth is not really true. Are they actually, is it real, or or are those people actually then afflicted by some sort of magic or jinn position, or could it be a combination of both?
It could be a combination of both. It could be either or. Yeah, yeah. Now, whether it's genetic or biochemical or something to do with abnormal neurotransmitter, I mean, so that, but also, I think we always have to, in Islam, we tend to look at things from a holistic point of view. Why? Because the whole creation, Allah Almighty created, everything is interconnected. Everything is interconnected. Me, the ecology around me, the environment, the cosmos, life, spirit, and so forth. Yeah. If you look at the, how everything is connected, if you look at all the scholars of the past during the Abbasid period, what I call the Islamic Renaissance, most of these people were Hafiz, they were polymath, but they were Hafiz, but also at the same time they were Hafiza, or they were specialists in the medicine and geography or theology or hadith. So all knowledge were interconnected here. And our Islamic worldview is holistic. So, we need to, when we look at things, we cannot look purely as biological factors or genetic factors or environmental factors. Again, go back to the nature-nurture problems. We need to look at it from a, not only genetic environment, but also, a spiritual being as well.
Jazakallah khair. Thank you.
Assalamu alaikum.
Right. I can just say what is somebody Balagh there?
Yes, Professor. Yeah, we have.
Do you know what when is my next lecture? Because I can't remember what time's my name, because I probably need to finish soon anyway. Do you know? Just check. Can you check it for me while I'm answering questions? I think just checking
Sure.
through anyway.
I'll update.
No, it's okay. I'm just checking. Oh gosh, where is it now? No, because come on, I'm listening to you. No, it's 5 o'clock, so I've got about 10, 15 minutes anyway. Okay, wa alaikum salam. Sorry. Yeah. Hello? Hello?
Hello.
Yes,
Assalamu
can you
alaikum.
hear me? Assalamu alaikum.
I can hear you clearly. No problem. Go on.
Okay, my name is Abdurrahman. I'm speaking from Nigeria. I'm not basically into Rukia, but I'm a student trying to learn about the activities. So my question is concerning an experience I had during a Rukia session, whereby the Roki was doing the dua according to the Quran and Sunnah, and then he had a woman beside him, who he referred to as a seer. The person tends to see maybe what are the sihr that has been done to the subject. So I'm kind of confused that does this not negate the principle of ghaib in Islam? How can someone see that, okay, so person has been afflicted with sihr, it has been tied in the water, it has been put in so place. So I would like to know if you've had similar experience, or if you could please say something about this. Thank you.
I must qualify that I'm not Iraqi. I know what it is, but I don't do it because, like I said, I always believe that there are things I know, something I don't know, or something I don't want to touch. So basically, it sounds a bit louche. It sounds a bit, not halal in that way anyway. But I need to know more things. But it doesn't sound right to me anyway. What you have suggested, it doesn't sound right. There's something weird about it anyway. Yeah. But again, everybody said, they use Quran Sunnah, but they use other things as well. So I'm sorry I couldn't help you with that. Like I say, I'm not an authority in that, but what you described sound a bit, you know, I feel uncomfortable about that. Anyway, let's put it that way.
Assalamu alaikum.
Wa alaikum salam.
My name's Mona. I'm calling from Dubai. I have two questions regarding Ruqya. What I'd like to know is there an accredited institution that we can refer clients to for Ruqya services? So, like, how do you sort of verify which ones
Yeah.
are authentic? It's very difficult.
You're quite right. You're quite right. I think there's none. No,
Yeah.
I mean, globally, there's none. Anyway, you know, not I know of, but I doubt it very much. I would have known anyway. You know, I mean, again, training. What about training? Do you need to be trained? Like hijima, cupping, you know, you need training. You can't have anybody going there and start doing hijima, you know. But all these alternative Islamic-based therapy are not really. No, there's no registration as such. You
It's
don't
very
know.
difficult then
There's no
because
directory out there. You just have to just learn from word of mouth, this imam and so forth, and you know that's how people do anyway. From this imam, they do well. You just use Quran, Sunnah, and then you use them anyways. That's not.
no,
There's no directory. No,
yeah,
there's no
sorry.
training either.
I feel that, you know, because it's such a widespread issue that, you know, if there was something that we could work toward collectively, you know, as a Muslim community, you know, to work towards this, that we could have somewhere where you have, because a lot of people go on a wild goose chase and they end up going to people who might end up, you know, sort of use white magic, and the situation gets worse.
Yeah. I have clients who's been abused by Iraqis. Yeah.
Oh, it's quite sad. And my second question,
Sexually abused. I'm talking about sexually abused there. You know, it's really, really serious. You know, and so you know, in India, Pakistan, many other places anyway, not there as well, but even in the Middle East, they've been abused. But so yeah, I mean, you can't control that. You know, it's very difficult. Yeah, I wish we could do something, but I mean, the only thing we can do is to train imam. Yeah. You know, into therapy. Give them some basic background of mental health and therapy. Yeah, because a lot of patients come to them. You know, some of them can deal with them. Like a lot of in America, there's a paper on it where imam, you know, do some sort of basic, you know, counseling. Yeah. I mean, they do anyway, but I mean, they give advice on inheritance and divorce and bits and pieces. Like I say, I've been working with imam for many, many years. People go to him for ruqya, basically, yeah, or some problems, and then he would refer to me. And if I think that the person needs medication, I would refer him to a psychiatrist. So there's a lot of sort of referral system, and we've been working together for many, many years.
yeah.
So yeah, I mean, you know, I think we can start by training people, training imams into therapy and counseling and so forth.
Or if there was a way to sort of compile a list, perhaps for maybe each country, or, you know, somebody would have to obviously, you know, take a lead on.
I know what you mean. I know what you mean.
Do you know what I mean? It's just so that you can refer people,
Of
because
course,
it's very difficult.
Yeah.
And sorry, I'm taking up a lot of time.
Assalamu alaikum. Can I just?
Wa alaikum salam. Is that Dr.
My name is Abdul
Turkey?
My name is
Turkish grammar here,
Abdul
but mix up. Anyway, I give my right to brother first, then I will talk inshallah, Sidi.
Okay.
From Istanbul.
Assalamu alaikum.
Wa alaikum salam.
My name is Abdul Basit and I am speaking from Germany.
Yeah.
I came here about 10 years before, 2015, to study.
To Germany.
Yeah, I came from India. Yeah.
Okay.
And when I came here, within first 2 months, I started feeling quite very different experiences.
Yeah.
And then I started having skin rashes out of nowhere. And I had a habit of using the ruqya, the manzil, you know, we have in India, Pakistan, those 33 verses from Quran, from the Sunnah that we recite in the morning and the evening to be safe. And when I used to recite ruqya, the ruqya ashariya of manzil, it used to get better. And after some hours, it used to come back. And it got worse day by day, although I used to continue my ruqya. and it kept on going. There was a battle between this me and this negativity. A point came in time when it started getting permanent in my body, and then I went to many psychotherapists and a lot of shuyukh to treat me. Among them, they were saying, yeah, this is ayn, this is a negative influence from there, you got some jinn connected or something, but I did not have any feeling of having any jinn. So long story short, I tried to get rid of it. It did not go away, to a point where I went to a sheikh and he did ruqya on me. When he was doing ruqya on me, at the same time, the same influence went on to him. And it was exactly going on to his body. And it was why I am telling this is because there are many questions coming up. So then I did research on it, and I spent a lot of time on it. And what I understood is that there are regular spells being cast. I mean, it's a part of religious beliefs of some different groups, that they do cast regular spells, and if there are practicing brothers and practicing sisters in the area, they get afflicted with those spells. So that's why we need to have a regular ruqya, when and the important part of this story, which I want to share here, is this is all an energy balance. They send out negative energy, and our positive energy should be enough to cancel out that negative energy. And when I did it, I increased my manzil from 1 time to 3 times to 7 times, and at times even 21. I mean, in the days when they have these cultural functions here, where they have big gatherings, it used to increase, and I used to feel it. And then I used to increase this manzil recitation, Suratul Yasin, Suratul Rahman, Suratul Jinn, 7 times, 10 times. And then it started getting better. So with my experience, this is what I learned, that we need to work regularly on this. And there are many brothers and sisters who are talking about various cases. Maybe this helps, inshallah.
Yeah, but I think the things is what people tend to very quickly, tend to forget. They don't do prevention. You go to the toilet, you have to make dua. Before you sleep, 3 calls, ayat al-kursi, before you leave house. So there are a lot of things you can do, which doesn't cost any money, that prevent us from, getting shaitan doing wash with us anyway, So there's prevention. It's all there. It's nothing difficult. It doesn't ask you to fast 40 days, every month or something, whatever it is anyway. I'm exaggerating there. But like I say, there are a lot of prevention, things that we need to do, dua that we do, dua is a tools of the believer, and this can prevent us from getting into those things anyway. Okay, Dr. Doreen?
Assalamu alaikum, Ustaz. How are you? From Istanbul, Suleyman Derin. How are you? Thank you.
Alhamdulillah. Good to hear from you as well anyway.
Yes, I just want to make a contribution.
Sure. Please do.
Ibn Sirin is a very classical scholar. His book, Seconds of Jinn, is a beautiful book in Arabic. I think there's a translation also in English. So people can read that book. Secondly, self-ruqya is very important. As you said, mashallah, very, well, that we should have all purification of our soul. When we have strong soul, no negative energy or shaitan or jinn can influence us. And myself, I read chapter Taha, chapter, Yasin, Ayat al-Kursi, and Mu'awwizatayn. So this really helps, That's my little contribution, if you accept. Jazakallah khair. Thank you.
Yeah. And like I say, thank you very much for mentioning that. Yeah, I think it's basic, sort of things that we need to do, and, which we don't, and then we get into trouble anyway. Okay, thank you. Right. I take a last question because I need to go. I take 2 more questions. And then,
I have 2 questions. My name is Amina. I'm from the US. I have 2 questions. My first question is, what is the difference between biological cause and chemical imbalance? Are those synonymous? I've heard that those 2 in your lectures. And my other question is, as Muslims, we believe that Quran is shifa for all kinds of conditions. So as healthcare professionals, we're also aware that antipsychotics have a wide array of side effects. I want to know your opinion on the strategy to start with ruqya, before we put the patient on antipsychotics, of course, if the Muslim patient family agrees to this, the Muslim patient and their family agrees to this, ethically, what do you think is the correct way to do? Because as physicians, as healthcare professionals, we are also considering the psychosis and all the mental health conditions that come under it. Jazakallah khair.
Yeah, I think very quickly, biology, or when to get biological, or chemical, they are biological, neurological factors. So that's not the big deal anyway. And I think that the thing is, of course, assessment of clients is very important. Like I say, sometimes if you treat diagnosis and you get it wrong, rather treat it as a patient with issues, with problems. And then if there's a need for medication, yes, by all means. But again, monitor it and evaluate it. And sometimes this can be done parallel, Ruqya is again, if there's no improvement, there's no outcome, there's no, improvement, small improvement like clients sometimes, but sometimes if you have somebody who have knowledge and imam on the team, and you want to do, he might do an assessment, then, you have some other perspective, and then you can decide what to do. But like I say, for me, I tend to get, in private practice, I tend to get all my patients to do Ruqya purely for prevention, not for anything else. Yeah. Okay, I'll take last question and then I have to go. I'm sorry, it just, please, yeah. Okay, next one. There are so many messages there. Thank you. I wish we had more time, but I can't. Anybody else? Yeah. No?
Assalamu alaikum, Professor. This is Iram from India.
Walaikum salam.
I just wanted to get some stats from you. You must have come across many cases. Does antipsychotics and Ruqayya, the combination, right? Does it really completely help heal the person, or it's like a lifelong thing that they have to continue doing?
But it all depends what they have. Do they have a Do they have a Jinn syndrome? Do they have a supernatural problem, or do they have a psychotic problem?
No. So if it's a psychotic problem also, like we have many healthcare professionals here, typically they say that the medicines, right, they have to continue for a long time, right? And some of these cases that you have talked about, like schizophrenia, they're like lifelong medications, right? So they just bury the symptom down for any patient, but they are like they're given to the patients for a very, very long time, right? So have you seen cases where people with mental health, not Jinn, only mental health, they have come back to normalcy, normal life with just a combination of antipsychotics and Ruqayya?
Nobody can, no matter after this sort of experience, come back to a normal life. There's no such a thing. But what you do, we try to improve their quality of life. Yeah, they may need medication for the rest of our life. It's like being a diabetic, you need insulin all the time, It doesn't affect you, I don't think in some cases, most of the cases, Ruqyya is not going to make any difference, There are some cases where combination of those can be effective, But again, you have to assess each patient as its own rather than trying to put everything. It's not a sort of application, it's tailor-made. Yeah, you have tailor-made rather than try one size fit all. So yes, sometimes they need either or. Sometimes they may need both, but in terms of both, very, very rare.
Okay,
Assalamu alaikum.
Okay. Right, you're the last
Sorry,
one.
just
Thank you.
one. Yeah, sorry. I'm Kulthum from Pakistan. I just wanted to ask that, like when a person visits Iraqi, he asks for one's address to, clear out the situation, or, if there's been black magic done or jinns have been sent. So is that the same case for the one who's doing it? If the address is unknown, one cannot perform black magic or send jinn to that place or to affect that person. Is that true? Do you have any idea about it?
Well, no, but you're not going to be involved with that. But also, no, it's not, tit for tat, really. It's not reciprocating. It's about, treating the person rather than the one who sent it anyway. So no, I mean, Iraqi, as I understand it, would try to treat the person with Quran, not because like I said, the jinn can be believers and non-believers. Okay, so what Ruqya, what we try to do with Ruqya is try to convert the jinn. Yeah, that's why they become resistant. That's why they become aggressive. That's why they become violent. Yeah, and so forth. You know, so that's what's happening because they're being burned by fire. When you read the Quran, they're burned. You know, they're getting burned by fire. That's why they become aggressive. Anyway, so you know, but like you know, we talk about people speaking in tongues. I mean, a lot of psychiatrists, of course, you know that what we call people call language, which is different. Now, is it psychosis? It's not psychosis. Now, a lot of cases to do with jinn as well. Okay, I don't know what the answer your question. I'm sorry about that because I need to go now. Thank you very much for being here, and I wish I could take more questions. You can write to me. You can write to Balagh, and we try to answer your question if we can, hopefully. And thank you very much. Anyway, whatever I talked about is good, is from Allah, and whatever is bad is from Shaitan. Myself, subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm sorry I had to leave because I got another session, you know, and I need to prepare myself. Okay, thank you very much. I hope you enjoyed, and we would send you the slides, PDF slide. Assalamu alaikum. Hopefully to see you in Salah, see you in one of the courses in Balagh. Assalamu alaikum. Have a good day.